Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. But before we get started, let's reach into the top hat for the magic illusion of the week. Here's an interesting trick to do. Borrow a bill from anyone at the table and then just tear it in half and take both pieces and say that you're going to try to put it back together again. You can have one person blow on one side, the other person blow on the other side, and then you put the two pieces back together and you got one bill. So what's the secret? To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Well, today's Pulp Fiction concerns the misconception that you have to reduce the occlusion on every tooth following endodontic therapy. And nothing could be further from the truth. I never reduce the occlusion unless the patient comes in and claims that every time they bite down, it hurts to push pressure against that tooth. That means the periodontal ligament is inflamed and the tooth is raising up a little bit out of the socket, and that probably indicates that you're going to have to do a little occlusal reduction. In most cases, however, that's not necessary. If you do have to reduce the occlusion, be sure that you minimally reduce it. I think this is just a little bit too much being taken off here. The other thing to keep in mind is most of the time we were taught in dental school at least to cap the cusp of every tooth that had to have a root canal. And the reason that they said we had to cap the cusps is because a lot of times endodontically treated teeth would tend to break off. I was taught that they were more brittle because they would dry out following the root canal therapy. Now we know the reason that teeth actually break easier after endo is because we take away way too much tooth structure just making our access, and we've talked about this before. So not only do we resist capping all of the cusps, we want to keep everything to a minimum exposure. But if you do know that you're going to have to cap the cusp anyway, go ahead and do your occlusal reduction first. There are many advantages to that. You'll find that there is no hyperocclusion once you've taken the tooth out of occlusion. You'll also find that visibility is much better. You can see into the canal a lot easier. You have no problem with your rubber stops because now you can have a flat surface for the rubber stopper to work against, and that's much easier than trying to get it to the landmark. And the best thing is the patient never changes their mind and says, you know, I don't think I want to get the crown or the onlay. You've already reduced the occlusion. But be sure and clear that with the patient, of course. One more thing to keep in mind, and this is just a minor point, but it is important. If you put a rubber stopper on a file, make sure it's on straight instead of all the way to the right in this illustration where it's off at an angle, because if you don't do that, it's going to be very difficult to get consistent root length measurements. So remember, we don't have to reduce the occlusion in all cases, and if we can maintain as much tooth structure as possible, we can simply close the access opening with a direct composite bonded to the walls, and it's rarely going to be necessary for us to even cap the cusps anymore if we do conservative treatment. Thanks again. This is Kit Weathers, and that's the Root Tip of the Week. Incidentally, if you have any questions or you have any products or ideas that you think we should be featuring on the Root Tip of the Week, please email me at kit.weathers@gmail.com. I look forward to hearing from you. Thanks. Well, that's it for another Root Tip of the Week. I'm Dr. Kit Weathers, inviting you to register at EndoRootCamp.com for free videos and special reports you can't get anywhere else. Meanwhile, I will see you at our next Endo Root Camp.